We are back in live at the World of Wellness. We have Wellness Week number 110, folks, 110. And I can say I am the only one who's been to every single one, right? Pretty amazing record. The Cal Ripken of World of Wellness, right? So, folks, we are here at here in Green Tree. Come on down. We have all different types of events coming on. So we have sauna, doing demos, cloud therapy, organo coffee, samples, protein smoothies, healthy treats, recipe guides, food, free food, books, literature, Canasi experts such as Joe Messino and myself. But we're here to help you. And, of course, everything's on special. The last major special of the year here at World of Wellness. So you want to take advantage. So my name is Mike Gallagher. For those who don't know me, I've been in the nutritional field for over 30 years now. I'm a certified lifestyle educator. I'm here to help out at these events, but normally I travel around and work with all different types of practitioners all around the country. And again, just training them, teaching them about our formulas, showing them the research, and again, using this right here, folks, this clinic right here in Pittsburgh as the model that all other clinics should follow, right? So what I wanted to talk about today is what is new at Nutritional Frontiers, right? What's new? So we have always working on new ingredients. We're always looking at new research. We are never resting. And we have some exciting new things that have come out in the last few weeks that we wanted to share with you, or some updates on some names of some formulas that we've changed recently just to make you aware of. So the first thing that we want to talk about, and these are coming right off our website, nutritionalfrontiers.com. So we just simply pulled them from it, looking at the text sheet. But the first one is Mood Boost. Now, this used to be called Mood Lift. And nothing has changed with the formula. Only the name has changed. All right. So we just want to emphasize that. Now, where does this formula fit? This is for depression. Okay. So we now, in the holidays, of course, it can be very festive, a lot of great times. But for some, this is not a great time. All right. Holiday blues. Thinking maybe some lost loved ones. And it's just a really, really tough time as the holiday period. So maybe you might not have this issue yourself, but maybe someone in your family or a friend or a neighbor, right? So that's how we would look at this. Natural antidepressant, okay? So let's talk about it. What's in this formula? And, of course, I would also add to that, besides the holidays, I would also say the weather doesn't help when it's 20 degrees outside and snowing. Of course, it also doesn't help when it gets dark at 5 o'clock now as well. So, again, for the next several months, this is when depression really starts to amplify. And we get lots of questions about that. So we wanted to feature it and talk about a little bit about it today. So you can, again, see all the different aspects of this helping. And now you see sleep disturbances. All right. So this formula should not make you sleepy, but it should improve the quality of your sleep. So what is this really working on is one of your major neurotransmitters called serotonin, right? So critical for brain function, right? And is a direct precursor to melatonin as well. But stress also plays a huge role in this, right? As well as not sleeping, excessive caffeine, alcohol, lack of exercise, all these things play a role. So when your serotonin is low, right, leads to all these major issues that we're talking about today, maybe feeling more aggressive or angry, more generally speaking. Again, some people turn to alcohol, anxiety, depression, right? On and on it goes here. All of these issues associated with depression. So what is the number one ingredient that we're using in this formula? It is 5-HTP, also known as tryptophan, right? So it's a 5-carbon molecule form of tryptophan. Now, we just had Thanksgiving. A lot of people talk about the turkey and Thanksgiving and making them tired. And it's actually not the turkey that makes you tired. It's the alcohol, the gravy, the stuffing, the mashed potatoes, and of course the pumpkin pie. That's what makes you tired. So 5-HTP or tryptophan should not make you tired. And this formula does not make you tired, especially when you add the other ingredients that were in here. But when you do go to sleep, it should improve your sleep quality. Okay, so some of my accounts, they actually prefer this for their patients who are struggle with sleeping as well. And folks, you can buy 5-HTP anywhere, but what makes this unique are the other ingredients that we're using in this. So we have B vitamins, B3, B6, and this is the active form. This is the most bioavailable form, this long-sounding name, paradoxal 5-phosphate. That's what you should always look for in the bottle. You should avoid paradoxal hydrochloride or HCl, folks. That is an inactive form of B6. And there's new research now showing that blocks your B from getting inside your cell as well, the hydrochloride form. So this is a much, much better form. And you have some magnesium in here. And then finally, ginkgo. So all these are cofactors that assist in raising your serotonin levels with the 5-HTP. And it makes it actually acts more as a time release as well, especially the ginkgo. So it's going to last longer in your system. It usually works faster than just straight 5-HTP. In addition to that, okay, so we would always say this is like 5-HTP on steroids or next generation tryptophan with this formula. Okay, now dosage on this. We would say we get the best results at 4 capsules a day. Okay, so for adults, typically we start with 4, 2 in the morning, 2 supper, or you can take all 4 at once. Okay, now if you are sensitive to medications or under 100 pounds, such as teenagers, could you just start with 1 or 2? Sure, right? But just through the years, what I've seen work the best clinically is 4 capsules a day with this, okay? Now, so it's a very, very simple formula, but extremely effective. Now, how soon should you see results? Well, usually you see results within 1 bottle, usually within 2 to 4 weeks. So it comes in one size, 120 caps. So 1 bottle, we will see and feel a difference. Okay, but some people see results even faster than 2 to 4 weeks. So everybody's a little bit different when it comes to the brain and how these ingredients work on the brain. But this is how we would recommend it. Okay, 4 caps a day. Now we would recommend that you continue to take this for at least 3 months, and then if everything is 100%, then you could start tapering it back down. Okay, so go from 4 to 3 to 2 to 1. But you want to get it in your system for at least 3 months. Now, let's talk about antidepressant drugs. So first of all, if you're on an antidepressant drug, can you take this? Yes. So I did clear this with Dr. Len, who's been a pharmacist for over 30 years. There's no issues with this with an antidepressant drug. Just take it at least an hour apart from the antidepressant, and it could be that bridge to help people transition off the drugs, right? But of course, never go cold turkey. You want to work with your prescribing physician or psychiatrist, whoever you got it from. But it can be very helpful, and for some, it's really hard to do that on your own. So again, be the bridge is another way that you can use this. But if you did look at antidepressant drugs like Prozac, for example, those typically take at least 4 to 8 weeks for working, 1 to 2 months, where this works in 2 to 4 weeks or sometimes faster. So when it comes to comparing this to a drug approach or the drug model, no one could ever say to you drugs work faster. No, they don't. Not on depression, okay? Not when we're talking about serotonin, okay? So just kind of keep that in mind. And again, anybody that you might know that is in this situation, really having a tough time, all we could say, try one bottle, and then we'll see. Go from there. Okay, we will know if this formula is for you. Okay, now we have another formula in our line called Calm Day, and that's more for anxiety due to stress and several other things. So again, I'll be doing a talk on that tomorrow. For anybody who wants to join me at 10 a.m. But Calm Day works on a different neurotransmitter, GABA. And so could you do both? Yes, you could do Mood Boost along with Calm Day because they do work on two different neurotransmitters, two different mechanisms of action. So some people, the anxiety and stress causes depression, right? So again, that's where we look at bundling or packaging them both together to get the best of both worlds. Okay. So on that one, before we move on, Phil, is there any questions on the new named Mood Boost? Okay. All right. Now I want to switch gears here a little bit. So we're in cold and flu season. We know that. And we will be for the next several months. So we've come out with a brand new immune formula called Immune Glandular. But it really should be called Immune Glandular Plus because we have added several other things to this. Okay. Now, we have several other formulas in our line that we've used for years, such as Immunomax. And folks, if you like Immunomax and you have got great results with Immunomax, there's no need to switch. But some people prefer glandulars, and in theory, it should work faster than any vitamin or herb. So again, that's why we came out with this one. Okay. And they're actually one of the doctors who helped us develop this, Dr. Darren in California. He is very well known in that part of the country, and he's a big fan of glandulars, and he's doing extremely well with this formula. And again, even though we've just had this on the market for a short period of time. Okay. So we know it will help boost your immune. It's going to help macrophage activity, right? Those are little Pac-Man that eat away at all the bad stuff and reduce infection as well, duration. But let's take a deeper dive on these ingredients. All right. So let's take a look at the glandulars that we're using in this formula. So first of all, the source of it is from New Zealand. And this is very important, folks. If a company doesn't tell you the source of their glandulars on the bottle or on the tech sheet or on their website, that is a red flag. That usually means it's coming from USDA beef, loaded with hormones and antibiotics. The source of our glandulars that we're using is coming from New Zealand. This is organic, hormone-free, antibiotic-free, as clean as you can make it. Okay, so we just want to emphasize that as well. Not all glandulars are created equal, just like all vitamins are not created equal. But what are the three sources we're using? So we're using thymus. Thymus is a lung tissue glandular. We're using lymph tissue, and we're using spleen glandular tissue. So why are we using glandulars? Well, here's the reason right after. It says it based on the idea that the organs or glands of mammals are structurally similar to the human counterparts and would contain micronutrients and other ingredients needed to bolster proper function in patients. Okay, so again, they have nutrients that nothing else has. All right, so like I said, in theory, you should get faster, quicker results. Besides being just an overall immune formula, there's another way that I would recommend this. All right. So again, maybe not yourself, but you might know somebody that has had some type of damage to their spleen, maybe in an accident or some type of dysfunction. Well, we never really had anything specifically enough for the spleen until now. Sometimes I do get asked those questions. So this would actually help with that situation. Another scenario would be your lymph. So sometimes we work with patients who've gone through, have breast cancer, females, and have had their lymph nodes removed. Okay, so that's one of the allopathic models that some women need that type of procedure. Well, there's always going to have problems with their lymphatic system from that point on, but this, folks, could help. This could help replace what has been taken out of your body using the lymph glands here, or just overall lymphatic issues if there's any edema or swelling involved. Again, this should help with that. And then finally, thymus, the lung tissue. Let's just say that you're still having challenges coughing, any upper respiratory issue, such as bronchitis or pneumonia or anything like that, and you're really still struggling to breathe, or still coughing, and you've tried other formulas and nothing seems to be working, well, try this one, because this thymus glandular here could actually help with that situation as well. So that's another way that you can look at this. All right. So we didn't want to just make glandulars. We wanted to give you a comprehensive formula. So what else did we add here? So we added vitamin A and natural C. Not the C is from acerola fruit. Okay. So that's the best form. And again, that's like target missile, right? Zoning in on those areas there of your immune system. Then we have your major minerals, zinc and selenium, that we added. And then we added all your major herbals that most people are familiar with, at least one of these: echinacea, angiographis, elderberry, wild indigo. So folks, this is a combination of glandulars, vitamins, minerals, and herbals all in one. And I've talked to some very advanced doctors recently, and they've been doing this a long time. And I asked them, have you ever seen anything that has this combination? And they're like, no, nothing out there in the nutritional world, folks, that has everything that this has in it. Okay, that's how unique this is, right? So let's talk about immune, just overall immune. Prevention is always the best medicine, right? Let's not wait till you're already sick. Let's prevent you from getting sick. So our normal dose to prevent is what the bottle says: 2 a day, keeps the doctor away, right? If you're under 100 pounds, again, for teenagers or sensitive, again, you can always just do 1, but 2 a day would be our point of reference there. If you are coming down with the cold or flu, we would recommend a loading dose, okay? So again, we just, the more serious issue you have, the more higher dosing we would be, but it would be temporary, would be the loading dose with that to knock it out as quickly as possible. And recently, one of the staff had laryngitis and took this, and it knocked it out very quickly, okay? Very quickly. And as soon as you do the loading dose, as soon as you're 100%, then we back it down, okay? So just short-term loading doses as well. By the way, if you're going anywhere where there's going to be more people, such as an athletic event or concert or traveling on a plane, I would do that day 3, just because there's more exposure. And then, again, as soon as you're not in that situation, back it down to the normal 2 a day, okay? So that's how you want to look at this. If you prefer glandulars, we have the answer now for you, okay? Now, how does this compare to Immunomax? Okay, so several people have asked me that. As I mentioned right at the beginning, if you do well with Immunomax, there's no need to switch, okay? Also, Immunomax comes in chewables. The glandular only comes in capsules. So if you prefer chewables, stick with the Immunomax. But this is one of our original formulas. We've had this for years and years and years. Again, something I take every day, have been taking every day for years and years and years as well. Again, but it's a different type of formula. Again, we're using patented form of Larix, DMG, olive leaf, beta-glucan, and a partially defractionated maitake. And all of these folks have researched to also strengthen your immune system. But if I was positioning the two, I would say this is more antiviral and anti-cancer, right? So that's how I would look at the two. Now, we have another formula, though, in our line called Immune Boost. Let me just grab Immune Boost. Okay, so Immune Boost would be if you already have an upper respiratory issue. Excuse me. So if you already are in an acute flare-up situation, that's where this formula would work the best. So if you already have a cold or flu, if you already have an upper respiratory issue, such as bronchitis or pneumonia or anything like that. So this formula used to be, we used to sell this in one of our kits. We call this Immune Kit. And it was 6 different bottles. And during the peak of COVID, these were the things that we would get asked the most about. And, again, it's challenging to take all 6 bottles every day, all day long. So it's very difficult, though, to make these in one capsule. So that's always been a challenge. But one of our NF ambassadors, her name is Dr. Lori Rome. She is a pharmacist and biochemist. She actually helped develop this and figured a way that she is able to make this in a capsule, all of these ingredients in one. So instead of taking 6 bottles, we're now using all 6 ingredients in one capsule. Okay. But these ingredients do take up a lot of space. And so that is why the serving size is 5 caps. Okay. Now, do you need to take 5 caps? No. Right? If you're just taking this for prevention, you could get away with 1 or 2 a day. But if you do have, again, already a flare-up situation, we would be more aggressive with the dose. Okay. We would go 5 caps, typically several times a day, to knock that out as quickly as possible. So, besides these ingredients, you have the NAC, you have the quercetin, right? So NAC is great for mucus and any sinus congestion issues. The zinc, overall immune health. Again, it's a patent trademark form we're using. Vitamin D, of course, we know. But we're also using this very unique form of vitamin C with this, a liposomal delivery system. It's a patented trademark form. Right here is the trademark symbol called Pure Whey. And there is a little write-up on it there. But this is non-corn. And because it's liposomal, it's going to be the most bioavailable, most absorbable form of vitamin C that you can use. So that is why we're using it there. Okay, so very unique vitamin C in this formula. And then let's go back to where we were. But last but not least, DMG, dimethylglycine. Talk about it all the time. DMG had a U.S. patent to boost your immune system. Plus, when you combine it with all these other ingredients, you're going to get faster, quicker results, right? So sometimes some people wait too late and then they already are sick. Immune Boost would be our primary, and either Immunomax or Immune Glandular would be our complementary in that case. Okay, so that's how we look at it for the rest of the winter. Now, can you get all these individually? Do we sell NAC by itself? Sure do. Quercetin, yep. Of course, DMG and zinc and D and C. But again, putting it in a formula like this, you're going to get faster, quicker results than individual ingredients. And again, most people are not consuming all of these things. So trying to simplify it for you. Okay, so that's where the Immune Boost fits in. All right, before we move on that, Phil, any questions on that? Okay, and then let's change gears completely with this formula. All right, so this one is a total game changer, folks. UTR. This is developed by a holistic OBGYN, Dr. V. It's the latest in her formulations for us. So she is a true holistic OBGYN. Dr. Mary Bell Verdialis is her name. Her main office is outside Atlanta, Georgia, but she has some satellite offices throughout the country as well as Mexico. But this stands for uterine tissue repair. Okay? Uterine tissue repair. Right there on the bottle in case you forget. So we've never had anything that can specifically help the uterus before, to help this major organ before, until now. And this will basically cover almost every single female issue there is. So it's truly unique. And again, working with some very advanced nutritional doctors throughout the country who have been around a long time have told me they've never seen anything like this. Okay, so this is really exciting. And again, you want to ask yourself how many companies are working with OBGYNs on developing formulas. I don't know anyone else. Okay, so just keep that in mind. By the way, Dr. V, I've asked her several questions. She always gets back to me on time. Very, very cool. Okay, so let's first of all, let's talk about how we are positioning this. Who can this help with? Well, right here, folks, second sentence in the first paragraph. This product was formulated to help support women with pelvic pain. Now, when we say that, we mean non-structural pelvic pain, recurrent pregnancy loss, heavy menses, scant menses, PMS, regular cycles, overall sexual function. It also helps to reduce all inflammation and the role that plays, especially in your uterus, cervix, and placenta, and the role it plays in PMS, regular menses, and most importantly, endometriosis. So we know endometriosis is a major hormonal imbalance, and we have had good results through the years with using EstroCleanse, and it can also be possible thyroid connection, but we've never had anything that can actually help to calm that inflammation down and help with the uterus itself until now. And we know the allopathic model is basically wait till it gets worse and then let's do a hysterectomy where they pull out everything, okay? And so we're trying to catch it before it gets to that point. So when we say this can change a person's life, it really could, okay? We're not joking. But I'm going to add several more things that are not on this text sheet that Dr. V mentioned at a recent seminar for us, as well as talking to her about this. But first of all hot flashes and night sweats, this should help with. Okay, so this literally will cover every stage of a female cycle. Secondly, uterine fibroids. Uterine fibroids. Now, with uterine fibroids, we would recommend combining this with one of our other formulas, Cybezyme, away from food, though, empty stomach at high doses. Thirdly, ovarian cyst. Ovarian cyst, we would also recommend combining this with another formula, fertility, which we'll talk about more in a minute, as well as EstroCleanse, which we'll talk about in a minute. Okay? Pre and post baby birth, especially post baby birth, to not only help calm the inflammation down, right, the womb, but to also help prevent postpartum depression as well. So I'll talk more in a minute about that scenario. Also, we would say if for females that had COVID, that's affected their reproductive system in any way, this should help. Or if you have gotten the COVID shot and you had a side effect that's affected your reproductive system in any way, okay? So that is a pretty long list of different benefits, right? So if you fit into any of those profiles, you should really give this a chance. Now, what's in it? So let's take a look here. So we have chaste tree. So that herb has been around for centuries, okay? And it's been shown to help with all these type of issues. Then we are using a newer type of turmeric. It's a patented trademark form of curcumin called C3 complex. And again, all the benefits of curcumin there, but basically major anti-inflammatory. We're also using boswellia, another anti-inflammatory. And another name for boswellia is frankincense. Okay, most people don't know that. But again, always a good joke this time of year around Christmas. If it's good enough for baby Jesus, it's good enough for you, right? So always remember that one about boswellia and frankincense. But the most unique thing about this is the very last ingredient, placenta. So this is another glandular. Dr. V is a big fan of glandulars. And folks, when we get the inflammation under control, which is why we're using 2 different anti-inflammatories here, the placenta can potentially heal and regenerate the uterine tissue itself. And this is the game changer. Okay? Now, let's talk about post-baby birth for a second, right? There are certain cultures around the world that the women do consume the placenta when they have a baby, okay? Part of their culture. And every animal in the animal kingdom also consumes placenta when they have a baby, okay? So it's part of our natural instinct there. And very interesting, I was talking to another account of mine, their husband and wife chiropractor, and she had a baby a couple years ago. And she actually, they found a midwife in the area that can actually take your placenta, encapsulate it, dehydrate it first, and then encapsulate it. And she took it. And talking to him, he said it was night and day difference when she took it and when she didn't for postpartum depression, right? And so that's just what we're talking about. And there are research studies about this that talks about placenta helping with postpartum depression. So that's what we're talking about, helping that combination. Okay. Now, typically speaking, right, for all of these issues, we would recommend, except endometriosis and post-baby birth, we would recommend a temporary loading dose of 4 a day. Okay. That is what Dr. V recommends in her clinic. 4 a day, 2 breakfast, 2 supper, or you can do all 4 at once. You should feel difference in 1 bottle. That's the important takeaway. But you might need a second or third bottle to feel 100% better. Okay? So again, everybody's different on this, but if you've had these issues for a long time, got to give us a little bit more time for it to work. But 1 bottle, you should notice the difference. Once you are 100%, then we would drop it down to this dosage, 1 a day, until we finish the bottle. Okay? 4 and then 1. If you have endometriosis or post-baby birth, those are more serious. We would actually recommend higher dosing. We would recommend temporary loading dose of 6 a day initially until you're 100% better, and then you back it down to 1 a day. Okay? So that's how we would recommend this. But all we can say at the end of the day, if you're a female has any of these issues, try 1 bottle. Try it out. See what you think. Okay? Now, let's go back to where it says helping women with pregnancy issues. Okay? So, recurrent pregnancy loss. So, if you're trying to have a baby and you're struggling, the most important question we would ask is, have you had any miscarriages? If you have not had any miscarriages, we would recommend the 4-day of the UTR along with this formula, fertility, that Dr. V also created last year. It's an ovarian glandular, right? So again, preconception health. So this is very, very unique as well. And this is going to help fertilize the egg as quickly and efficiently as possible. And it also focuses on reducing free radical damage and mitochondria and detoxification all at the same time. So the dosage in that scenario, if you're trying to get pregnant, would be 2 a day. Now, we would recommend the fertility up until the first trimester. After that, we would discontinue it. And that is exactly what Dr. V recommends at her fertility clinic outside Georgia. Okay? So UTR, by the way, once you're pregnant with UTR, we would drop the UTR down to 1 a day until the baby's born. And like I said, then we go bump it up to 6 a day temporarily. Okay? If you have had miscarriages and you're still struggling to have a baby, that is a more advanced situation. We would rather speak to you personally about that. And also, we would, Dr. V recommends that they call her office in Georgia, and we can give you that number. But that she would want to do more testing as well. And, the reason why I specifically asked Dr. V this question is one of my other accounts, unfortunately, is going through this right now. She got married late in life. She's 41, and she just had her second miscarriage, and she's totally devastated and feels helpless and hopeless. And I connected her with Dr. V, and Dr. V can do teleconference calls and recommended some additional testing. And now she has hope, right? Now she has hope. And that's all we can do, folks, right? Get you connected with the right people if you have these type of situations or have any family members with these situations or friends struggling to conceive as well, okay? Now, let's go back to the UTR for 1 second. Does this formula really, truly rebalance hormones? And the answer is no. No, it doesn't, okay? So this is going to help calm the inflammation and help that specific organ system. But 99% of these situations right here are all hormone related, bad estrogen related. And so we need a binder. We need a formula that's going to bind to the bad estrogen and pull it out of your system as cleanly and efficiently as possible. And that's where the Estro Cleanse formula comes into play. Now, again, we've had this for many, many years. It's one of our top sellers. And again, some very unique ingredients in here. But again, focusing on eliminating the bad and ugly estrogen, leaving the good, which will indirectly help rebalance progesterone all at the same time. Okay, so that's the whole idea here. So what are those binders? Well, indole 3-carbinol, which again comes from a cruciferous vegetable family like broccoli. That was the original, goes back to 1980s. Okay, when you chew on broccoli or Brussels sprouts, keep chewing and chewing, it produces a metabolite, and this will create this ingredient, indole 3-carbinol. So it's going to pull that bad and ugly estrogen over time. Then in the 90s came out with DIM. And so if you keep chewing on that broccoli, it'll later downstream, as they like to say, it'll produce this metabolite, DIM. So again, some companies, and we do sell DIM by itself if you want it, but we get better results when you combine these two together. In the last decade, there's been emerging research with this ingredient, calcium D-glucarate. Again, from fruits and vegetables, such as Brussels sprouts, broccoli, and oranges and apples. So there's even more research on this for breast cancer specifically, which is, again, the ugly estrogen. So we put all three of these together. And again, very unique, that combination. But we didn't stop there. We added 2 different anti-inflammatories, a patented trademark form of curcumin, of turmeric called curcumin. And we also added isabi, right, which is a patented trademark form of wasabi there as well. Then we added some anti-aging ingredients with resveratrol. And also we added, back at the top here, tocotrienol as vitamin E. So folks, this is a very unique formula. It's not only going to help pull that estrogen out, but also, as I said, anti-inflammatory, because these estrogen issues are very high in inflammation, as well as anti-aging, all at the same time. So I was doing a talk for a group of women at had a new location that I was working with, and I went over this with them in detail, and they were just blown away. They were like, "Wow, I didn't think there was a formula that existed like this, that it can help with all these different issues all at the same time." And yes, it can. So what do we recommend if you have these issues? We recommend 3 a day for 3 months, okay? It takes at least 3 months to stabilize those hormones. If you stop after 1 month, 1 bottle, usually those symptoms come right back. So 3 a day for 3 months is the key magic number when it comes for this formula Estro Cleanse. After that, if everything's good, then we can start tapering down off of there, okay? But we would really recommend, if you have these issues, combining both the UTR, right? Going back to what we originally talked about, the UTR, and also the Estro Cleanse at the same time, folks. That is the ultimate bundle for 99% of these hormone issues. Okay? So, let's review. Mood Boost, new name. Just gave the name, facelift on the name. The Immune Glandular, right? Powerhouse immune formula for cold and flu season, and then also the new UTR. All right, all of them game changers in their own way. Okay, if you want to talk more about it, come on down. Again, all different activities, right? So emphasizing again, all different things: free food, free samples, free books, saunas, right? All different testing, right? Organic coffee treats, all kinds of stuff happening. And again, we can go into more detail about any of these things. But the phone number, folks, if you just want to call it in and take advantage of the specials, 412-922-9355. Again, I'll say that one more time, 412-922-9355. Phil, before we wrap it up, any questions? All right, folks, that is all I have to say. My time is up, but